Today we're going to show you a demonstration of ear candling, which is sometimes referred to as thermal auricular therapy. And the one thing I'd like to point out immediately is that some people believe that ear candling can remove any of the blockages or any of the wax within the ear canal. But really, a lot of us, and I include myself in this, use it specifically as a relaxation treatment and use it just to promote a sense of well-being and calm. And we don't believe that anything inside the candle is what was contained within the ear. So please don't watch this video and believe that we're suggesting that the candles remove the wax. It's very much about relaxing the client. So as you can see here, in your startup kit, you've got your ear candles, and there's so many different styles of ear candle you can get, from plain to honey to aromatherapy. Then you've got your protective disc that some people use and some people don't. And this disc is actually used, you pop the candle through it, and it's basically a safety precaution so that if any of the candle were to fall as it burned, then this would actually protect the ear and it would not in any way damage your client. Although it's actually very hard to do this because you are using everything safely and you're taking all precautions. Then you've also got either your matches or your lighter, just something to safely ignite the candle. Cotton buds or Q-tips, just for cleaning before if necessary and after. A bowl with water and some massage medium just for after the ear candling. It's quite nice to do a lymphatic drainage or pressure point massage just to encourage any removal of any lymph that might be there, if there's any puffiness. There's so many different reasons why people may choose to have an ear candling treatment. So it's good, if possible, to offer a mini massage as part of the treatment. And the treatment all in can be anything from half an hour, 45 minutes to an hour. Now, the best way to set up a client is to have them sitting comfortably on their side and cover them completely, either with towel or with a cover so they're nice and warm, and then place a towel around the ear, covering the hair. So if there's any danger or any possibility that there could be any naked flame near the hair, you are removing that risk. Now, obviously you've done your consultation. There are lots of contraindications when you're working with the ear. There are some obvious contraindications, such as grommets, or if someone has a hearing aid, if they've got an ear infection. But just make sure that you don't perform this treatment without understanding why you're doing it, and if possible, go to a professional, because what you don't want to do is cause any injuries to yourself or others. So you light the candle, and then what you're doing is very gently placing it just on the outside of the ear. You're very gently placing it just in that outer section. You're not pushing the candle into the ear at all, but just enough so that what's happening is that little vacuum is helping to warm up and soothe and ease. Because you've lit the candle first, there can be a little bit of smoke coming out of the part which goes into the ear, but that's okay. But again, if you see smoke when you've placed it in the ear, then you might have to just adjust exactly where you're positioning the candle. But what you want to do is just hold it in between your index and middle finger, or sometimes it's the middle and ring finger, deciding again how comfortable it is for you, and you're just holding that candle in place. Now, as you can see here, we've just edited a little bit out where it's gently burning down, but as it burns, it's almost like a cloth consistency on the candle, so little bits might fall off, but they're not burning when they fall off. They're already burned and they're not warm, so if they do fall on towel, they'll be fine. What your client might hear in their ear is very gentle crackling. Some people have said it feels a little bit like you're listening to a seashell, and it's the lovely sound of the sea. It's just a very relaxing procedure. But as you can see here, you don't want to take the candle too far down. So exactly where it is just now, maybe about 3 inches or so to go, you very gently remove it from the ear, and you have your cold water beside you, and you immediately place it into the cold water. Now what you'll do at this point is you'll gently clean out just the open section of the ear. You are not placing that Q-tip anywhere near the ear canal. It's just if there's any residue from the candle there, that's all. And it can be, again, because there's warmth generated, it could be residue from the candle. There are so many things that you're just making sure that there's no residue left over. And then if you want, when the candle's completely cool and the treatment's finished, you can open it up and you can have a look at what's inside. But again, I would do this just for curiosity. Do not believe that the powders and the different coloured textures in that candle are earwax. Just enjoy the treatment for relaxation. And then to finish, it can be very pleasant to do that little pressure point massage, just to give the lymph and the circulation a little boost. You've given the ears, you've given that area a nice, if you like, cleansing treatment. And what's lovely to finish it off is to massage towards those nodes. And by massaging towards those nodes, you're increasing the lymphatic drainage. If anyone's got any sinus problems, you're helping to just give that a release and a flush. And again, working on the chin, on the jawline. These are all very therapeutic and very beneficial massage movements, which will aid and enhance the ear candling treatment. It's a lovely treatment to experience. It's a lovely treatment to perform. And if anything, it's an hour of complete blissful relaxation.